Hi, I'm Dr. Surindher. I'm the Director of Cosmesis India. We are an aesthetic surgery and aesthetics clinic in the heart of Bangalore in Brigade Road. Often we get a query regarding surgeries to improve the jawline. Most commonly from men, but you also get it from women as well. Now the problem with the jawline is there could be a problem which might be the bony problem where the bones itself are not developed well enough. Secondly is there could be a problem with aging because of which you have the fatty deposits around the angles of the jaw and around the jaw which mask or cover the bony angles of the bone underneath, and that's why it doesn't show up properly. Or it could be a problem of loose skin. So depending on what the problem is, you have to see and identify the problem and then do the procedure necessary for it to improve the jawline. So most commonly in youngsters what we would see is a maldeveloped jaw. Maldeveloped jaw means the jawbone itself is a little weak. So in those cases what we need to do is basically to enhance the jaw. The enhancement of the jaw or the actual jaw enhancing surgery is by putting implants. There are angular implants which you can put to make the angles more prominent. So we give you a cut inside the mouth and put an implant in to give you a better angle. So it widens the face and gives you a more squarish muscular look. And because you are putting more volume in, so it tends to become a little more prominent. The second thing is the same thing you can do for the chin. So if there is a retruded chin or this jawline is not very strong enough, then you can put in an implant to improve that. Non-surgically, you can do some procedures. Nowadays you have fillers which can be injected. So we inject it along the jawline to give you a much better shape and much better size to it. Another option when you have a masking effect, when there is a lot of fat or the skin is loose, is you can do something called liposuction. So when we do a liposuction, we are taking out the soft tissue or the fat there. So what happens is we take out this liposuction of the face and then we do a liposuction of the neck. So the jaw ends up becoming more prominent. Along with that, sometimes you can even do threads to pull up the skin if there is jowling or early aging. Then you lift the face up so it gives you a better contour. So depending on what the problem is, whether it's in the bone or whether it is in the soft tissue, you identify the problem and then you treat it accordingly.